Hello, my name is Elizabeth Ashton Northrup. I'm working on my Master of Public Health through Western Governors University. I'm here in St. George, Utah, although the university is in Salt Lake City, Utah. I'm about to do a presentation on negotiation and mediation for equitable public health policy implementation. And let's get started. Okay, so this is a presentation that I am doing through Panopto. So we're going to first talk about nurse turnover crisis that we currently have in Clark County, Nevada. Leadership changes in urban hospital is what I'm going to focus on, especially during the COVID-19 pandemic and following. Nurses face burnout and low peace due to anxiety, depression symptoms. This led to massive burnout. Medical staff already experience burnout, but the pandemic made this much worse, and it's defined as getting to the point of depersonalization. So what happens is they get so burned out, they can't get personal with their clients because they're just so past being able to function because they're so burned out. And lower feelings of accomplishment is associated with it as well. Burnout can also lead to more medical errors, wanting to leave the place of employment, and can even lead to suicide thoughts and behaviors. Dealing with the medical community and the high demands of this professional in these professional organizations in general. So one external issue is that there can be a lot of negative online reviews and word of mouth feedback after a clinic's reputation in the community is kind of tampered with. This stems from health workers at risk for psychiatric and psychological disorders due to the demanding expectations of the pandemic, including anxiety, depression, PTSD, and substance abuse. And this can create a very unrealistic work environment in terms of expectations. For the external use issue, one challenge nurses face while experiencing burnout is needing to overcome feeling compassion fatigue, which leads to personal and professional relationship suffering, staff leaving, and patient safety being at risk. The second challenge in the internal issue these facilities face is the stress of nurses helping patients and experiencing secondary sorrow, anxiety, and stress. So I actually have a client that the grandma is a nurse, and she experiences this quite a lot as well, facing secondary sorrow, anxiety, and stress, which can lead to burnout. It can be challenging, but needs to be overcome. The World Health Organization has been involved and sees burnout as an occupational hazard, including exhaustion, negative feelings towards one's job, reducing professional productivity, and energy deprivation. So we're going to go over its overarching goals, the target population, its anticipated impact in the community as outlined in my scenario. So an appropriate leadership style is to navigate internal issues with nurse burnout is using authentic and transformational leadership skills, which can be enforced through empowering and promoting very engaging conversation, nurse engagement to ensure that we're fully, as leaders, able to understand the needs of what nurses are dealing with and their needs, and assessing whether they're close to facing burnout. The value-based care is optional for health professionals to reduce healthcare costs, medical health issues, stress, emotional exhaustion, depersonalization, and decline of personal accomplishment. The National Academy of Medicine relates well-being, health, and safety to reducing burnout rates. Pertains to leadership styles, which could help empower employees by actively listening to the staff's positive and negative experiences. Employee rounding a proper recognition also helps lower rates of nurse burnout. This leadership style involves using positive reinforcement tactics such as gifts, candy, thank you notes, creating celebration and gathering to reward exceptional performance. I personally have experienced this at my job where I implement behavioral therapy. We use a lot of positive reinforcement with rewards, and I feel it's much more effective than some companies using the point system. I'm not a big fan of the point system. The point system, I feel like, leads to burnout instead of rewarding employees with positive incentives like gifts, positive reviews. Evaluate negotiation or mediation strategies that are intended to address the following conflicting interests or viewpoints of among stakeholders, including, so we're going to talk about the leadership principles that align with the leadership styles that I'm talking about, that guides decision making and actions within the organization, which empower nurses with giving appropriate mental health resources, adequate support, and implementation opportunities of growth and fostering innovation in their career. These leaders educate staff about financial resources, incentives, such as providing nurses with a bonus after completing a certification in their what they specialize in. Since nursing burnout is a global issue, leadership roles provide empowerment strategies, support nurses, implement transformational leadership styles, and unify the work team environment. Data indicates that transformational and authentic leadership styles show effectiveness using inspiration and motivation to help nursing staff morale. So, this type of leadership ensures nurse engagement, improves work satisfaction, reduces anxiety, depression associated with burnout, promotes the quality of nurse care with patients. In addition, this type of leadership style reduces negative online reviews, and it's shown to improve online score ratings, likely thinking more positive than negative about an experience in a medical facility. With rampant technology, leadership styles, tools, strategies, and resources um, are effectively used because they can be used anytime, anywhere, in real space using technology. Strategies allow hospitals to communicate positively with traditional methods. Resources used are easy with a laptop or iPhone, Android, and is a global, fast paced, interactive communication, 24 hours a day communication style, which allows leaders, groups, and hospitals to interact appropriately at all hours of the day, especially since hospitals are 24 hours. This is a appropriate leadership style addressing technology as well as that seems appropriate for facility since many of them are 24 hours. The tools also used in technologies to invent new contact of leadership and teamwork combined with more adaptable and flexibility. These styles show improvements in attitudes, feelings, thoughts, behaviors, and performance within hospital setups, incorporating classical changes in visual form to innovate hospitals' online reviews. Now we're going to talk about the social dominance theory. When nurses' well-being and socio-emotional needs are met, less turnover will take place. And this type of leadership is called socio-dominance theory, where a group within the hospital staff will have effective leadership within the hospital setting. Procedures are perceived by staff and analyzed while individual consideration, idealized influence, inspiration, motivation, and intellectual stimulation are also used as tools and strategies within the leadership style, which have proven to be effective. Two approaches for engaging stakeholders and fostering collaboration to ensure fair and inclusive participation among diverse populations. So, since our clinic provides essential primary healthcare services to many patients with chronic health condition, low family income, and culturally diverse populations, recently operating at full capacity, while the demands increase due to a growing population. I feel like it's best to hire additional staff to accommodate this increased demand and is ethically challenging but needed in this scenario. Longer wait times significantly hurt a patient's satisfaction, and therefore improving a patient flow by hiring staff is more cost effective. In addition, physician burnout rates are double compared to other work professionals and face the risk of burnout. Burnout symptoms I've talked about before, but I'll just keep emphasizing. Um, uh, it de- they actually decrease empathy and compassion. So when nurses get close to burnout, they have less compassion and empathy towards their clients. There's more medical errors, there's more depression and poor communication skills, and more and just poor communication in general within the clinic's dynamic. In addition, when a doctor leaves a clinic, it becomes costly for a clinic, and therefore it's better to keep a doctor happy than hire more staff. Physician turnover leads to unhealthy cycles of increased burnout and puts more demands on clinics. Therefore, hiring more staff to give the other staff more breaks is essential for long-term results. The organization ethical challenges conflicting values in regards to quality of care, making timely appointments, and addressing patients' needs while on a strict budget. The ethical dilemma would be more to hire more staff, which might be out of budget, or keep current staff, but wait times might be longer. A need for high quality care clinic operations is on the rise, and at the Institute of Medicine, it relates that quality care is an all-time rate of demand and efficiency. Compounding health and economic burdens affect patients' healthcare systems and the average length of stay has been an increasingly current struggle. To improve the clinic's operational systems efficiently by measuring the length of stay and addressing these aspects, physical exams, essential treatments, blood work, and testing must be done within a certain amount of time. An ethical challenge with efficiency would be patients sharing rooms in a small area, although conflicting issues can arise. Room space might lead to longer wait times. Hybrid rooms allocate